Okay, I can't believe it. We are at the end of our cardiovascular unit. Oh my goodness, this is our last topic. There are two other things that I may make a video on. One is about something the Lord made, but we're watching that movie in class. And the second thing is a review, but can't make the review yet till we see where the problems are. So this is like our last topic. Oh my goodness, names of blood vessels. So the aorta, largest artery, carries blood to the body away from the heart. Okay, where the aorta starts at your heart, it's about the size of a garden hose. Holy cow, big. The carotid artery. So the carotid artery is in your neck. Okay, it carries blood to the brain and the head, and it is where you would feel a pulse in someone who is unconscious. The jugular vein. So it runs right along next to the carotid artery. It's also in the neck, and it's going to do the opposite, carry blood from the head, brain, neck back to the heart. The brachial artery. Now, I could have done brachial artery and brachial vein. So assuming there's a brachial artery, there's its partner, the brachial vein. Okay, it carries blood to the arm. The brachial artery is felt here in the cubital fossa in the elbow, and that's where the doctor will put a stethoscope when measuring your blood pressure. The thoracic artery, it carries blood to your thorax and chest. Okay, so you can see right here, here is the pointing at the thoracic artery. So this artery right here coming down like this, carrying blood to your thorax or chest. The hepatic artery right here, carrying blood to the liver. We also have, guess what, hepatic vein, okay? We have the gastric artery. So the gastric artery is going to carry blood to the stomach. Gastric vein, carry blood away, okay? Renal artery. So you can see right here, renal artery. Can you guess what this one would be then? The renal vein, okay? Inferior vena cava. So here it is right here. Inferior vena cava going up like this, okay? Is going to bring blood from the lower part of the body back to the heart, to the right atrium. Then we have the superior vena cava, so like right here, that is going to carry blood from the upper body back to the heart. Same spot, right atrium. The pulmonary artery, it carries oxygen poor blood from the heart to the lungs. Pulmonary artery from the heart to the lungs. Pulmonary artery from the heart to the lungs. Pulmonary vein. Pulmonary vein brings oxygen-rich blood from the lungs back to the heart. From the lungs back to the heart. It's going to bring it to the left atrium. The subclavian artery, so your clavicle, remember that frequently broken bone? The subclavian artery is found underneath the clavicle. So it has branches that go to the neck, to the thorax, to the shoulder, to the arms. There's the radial artery. So here is my forearm. When I'm looking, thumb side right here, radial artery. I could feel my pulse right here. It carries blood to the radius side of the forearm. Same thing. So here's my hand again. Okay. Radius is going to be here on the thumb side, the radial artery. If I go on the opposite side over here, I have my ulnar artery. So it's going to be on the pinky side, the ulnar artery. The femoral artery is in the leg, the thigh. It carries blood to the lower section of your body. The popliteal artery behind the knee, it carries blood to your lower leg. That's one of the pulse points that a doctor might feel if they have questions about your circulation. Okay, there we have it. Some of the blood vessels. There are a whole lot more, so many. If you ever look at a picture, like, oh my goodness, but these are the only ones I'm asking you to remember the names of. Super kind of me. So just learn them. That's it. And we're done, except for review and something the Lord made. Pretty exciting.